So back in 2009, I was diagnosed with breast cancer, and at that time I took the BRCA test. Now BRCA is a gene mutation that increases one's risk of breast and ovarian cancer. I tested positive for BRCA1. In other words, my risk of getting breast cancer or ovarian cancer is a lot higher than the general population. Now, since I already had a bilateral mastectomy and chemo for the breast cancer, there's really not much more I can do to reduce my risk of breast cancer. So now what I need to do is focus on reducing my risk of ovarian cancer. So right now, there's really not an effective way to screen for ovarian cancer. When ovarian cancer is detected, a lot of times it's spread to other parts of the body. Now, there are various options for BRCA-positive women in terms of surveillance and risk reduction. Although it's not always effective, some women may choose to have their tumor marker, the CA-125, checked and also ultrasounds performed every 6 months. Oophorectomy, which is the removal of the ovaries, is really the most effective way to decrease the risk of ovarian cancer. Many doctors recommend an oophorectomy around age 40, but unfortunately, bilateral oophorectomy before natural menopause is associated with a lot of negative outcomes, such as increased risk of cardiovascular disease, cognitive impairment, bone issues, emotional and sexual problems, and increased risk of premature death. That's pretty scary, right? So what do you do? Well, recently, there's been some research that suggests that ovarian cancer might start in the fallopian tubes. Now, because of this theory, doctors are starting to recommend salpingectomy, which is fallopian tube removal, in women that are BRCA positive and want to reduce their risk of ovarian cancer, and also women that have not gone into menopause yet. Now, there's a study at MD Anderson called Prophylactic Salpingectomy with delayed oophorectomy. And they're currently recruiting patients or participants. And the goal of this research study is to compare ovarian cancer screening, risk-reducing salpingo-oophorectomy, which means removing the fallopian tubes and the ovaries, and also just removing the fallopian tubes and later removing the ovaries. Now, after a lot of discussion in my own research, I chose to participate in the fallopian tube removal option for BRCA-positive women at MD Anderson. For me, I felt like my body was a ticking time bomb. Now, at the age of 37, I was having a hard time waiting until 40 or more to reduce my risk of ovarian cancer. And at the same time, I also wasn't quite ready to face all those issues that are associated with surgical menopause. So I'm going to tell you a little bit about my experience getting my fallopian tubes removed at MD Anderson. Now, we live in Austin, so we had to travel to Houston to get the surgery done. It also requires some frequent visits about every 6 months or so to also get checkups. On September 15th, we got to MD Anderson pretty early. My surgery was scheduled for 8:30 and they wanted us there at 6:30. We waited a long time in the waiting room and finally I was given a room. They started the IV. They gave me one of those nausea patches that goes behind your ear because I'm prone to motion sickness and they were worried about me being nauseous from the anesthesia. And then by the time they wheeled me out and gave me what they call the happy drugs, it was probably about 9:15 or so. Now, the surgery itself went well, but I did have a complication during surgery. For some reason, maybe because of IBS, my small intestine swelled during surgery. So to be sure that there weren't any punctures, both my doctor and a gastroenterologist spent a lot of time checking my whole small intestine. No injuries were found after a long time of pulling and stretching, and I'm not sure what else. The surgery was supposed to last an hour and a half, but because of the intestinal problems, my surgery actually lasted about 3 hours or so. Normally, when you have fallopian tube removal laparoscopically, it's an outpatient procedure. But because of my intestinal complication, I had to spend the night at the hospital. My doctors wanted to monitor me overnight and make sure that I didn't have any intestinal complications. The pain after surgery really wasn't too bad. On a scale of 0 to 10, as I was asked quite frequently, the pain was probably around a 3 or so. My stomach was very bloated and very gassy. I was told what they do laparoscopically is they add a lot of air to your abdomen, I guess so they can see better. And I was warned about this before surgery, and so I knew to expect to have a lot of gas after surgery, and you really do. It's just to give you a heads up. The most annoying part of the recovery was actually the side effects from either anesthesia or that nausea patch that they gave me. Somehow no one thought to remove the patch after surgery, as is typically recommended. So it was left on me for a few days until I was finally complaining to my doctor as we were getting ready to go back to Austin. I had really blurry vision, especially up close. I had a hard time texting and reading. I was also nauseous and lightheaded and dizzy, and that lasted for about a week. I'm finally feeling a lot better now. It's been about 8 days after the surgery or so. I'm mostly back to normal. I was able to drive today, but I'm still a little weak and a little nauseous, but the lightheadedness is mostly gone. Now, I do have a few restrictions now after the surgery. So my doctor told me to wait about 4 weeks before I can go back to running, and then wait 6 weeks or so to lift more than 10 pounds and to do any kind of abdominal exercises or Pilates or things like that. So now I'll show you a little bit about what my incisions look like. So normally when you have your fallopian tubes removed laparoscopically, you'll have 3 incisions. You'll have 1 each to remove the fallopian tubes, and then 1 where the camera goes in. But in my case, I had an extra one due to them checking my intestines. And I did have some bloating afterwards. I still feel like I have a little bit of air still in my belly here. So now that I'm feeling a little better, I went on my blog and I wrote a little bit about my experience, mostly what I was saying here in the video. But you can also go onto my blog, onto the post, which I'll put a link to, where you can get some more information about some studies and articles and things like that. You can find out more about fallopian tube removal in terms of reducing ovarian cancer risk. So feel free to leave your questions and I'll try to answer them as soon as I can. All right, thanks.